All right, we are live on Facebook. Welcome everyone who's joining us today, seeing it live or in the future when it's recorded. We're really glad you're joining us today. September is Healthy Aging Month. So Dr. Vin and I are going to be talking about ways to keep ourselves healthy throughout our life and age well, basically. So we're glad to be back in September. I know the times changed, so hopefully everyone can catch this video at some point. And yeah, we'll get started right away. Thanks for joining me, Dr. Vinny.
Thank you, Krista.
Well,
I was excited to talk about these topics.
Yeah, as I said, September is Healthy Aging Month, and we have so many ways to keep ourselves healthy. And I think today we're going to talk mostly about diet and nutrition. So, what are some ways that we can incorporate new food into our diet, maybe if we haven't, or remove things from our diet that maybe are going to hurt us down the road?
Sure. Maybe we can even back up a little bit from that.
Sure, please.
And talk about what, like, maybe we shouldn't be eating, and why.
Yeah.
So, there's a term in the integrative functional medicine community, the SAD diet, SAD,
Yeah.
The standard American diet.
Very sad.
Yeah, very sad. It's usually points towards a high carb, high fat, excess calories that, unfortunately has led to an epidemic of obesity, insulin resistance, prediabetes, and diabetes. And why is that? That is because, especially the carbs, causes insulin to go up. The carbs, and sugar is a carb also, obviously. But the more carb you have, the more sugar you have, the more your insulin goes up. And the more your insulin goes up, that leads to insulin resistance, which causes excess fat to be laid down. That impairs the functioning of organs. Insulin resistance gets worse. And that eventually leads to prediabetes when the body cannot actually control the blood sugar in that range of 60 to 99. So we think optimally, probably it should be in the range, around 85, 99, probably well on your way to insulin resistance. And then prediabetes when your blood sugar is over 100, but below 126. And then once you get over 126, you have frank diabetes. Again, that's usually a couple of things: high insulin resistance, and the organs are being impaired, especially the pancreas and the liver. And pancreas can't put out enough insulin to control the blood sugar anymore. So, so eating carbs, eating sugar, having excess amounts of that, eventually, for most people, leads at least to insulin resistance, pre-diabetes. Unfortunately, I think we're getting to the ranges of like 50-60% of people are getting into that range. And diabetes, about a third of the country is diabetic now. I mean, that's just like enormous numbers.
It's sad, is what it is.
Yep, because it's sad.
Yeah, because it's sad. So if there are people who are on their way kind of toward diabetes, they're pre-diabetic, and they do start changing their diet now, maybe alternating from a high carb to low carb and removing some of those high fat foods, is there a way to reverse that process so that they can continue living throughout their older age in a more healthy way without the worry about having diabetes diagnosis later on?
Yes, I mean, for many years, and maybe still in some of the conventional circles, it was always thought that progression that I outlined was inexorable, that once you were insulin resistant or pre-diabetic, you eventually were just going to progress to diabetes, and there was nothing you could do about it. And nothing could be further from the truth.
That's great to hear.
You can at any point stop this process and reverse it. The further along you are in the process, the harder it is to stop it and reverse it. You have to do harder work the further along you are. But if people get the carbs and sugar out of their diet, if they reduce their excess calories, if they become active, if they eat, it's tending almost towards what some people might call a keto diet. We're not looking for hard
Right.
keto here, but at least a keto-like diet where people are, having low carbs. We want whole foods for them. We want lots of veggies. Um, that type of diet has been shown to reverse diabetes, reverse pre-diabetes, reverse insulin resistance, get rid of fatty liver. That's what it's all about, is having that type of diet.
And removing those does not mean the end of the world and that you have a plain, very, boring diet for the rest of your life. There are so many different recipes that you can kind of mimic, like the spaghetti and meatballs, or even pizza these days. So instead of doing the big spaghetti and meatballs, you can do even like a spaghetti squash. I've done before, and I mean, when you put the sauce and like maybe even turkey, like a ground turkey rather than a meatball, it's delicious, and you can then splurge every once in a while on the real deal.
Right, exactly. There's nothing you cannot have, but you probably shouldn't be having it every night, kind of
Right,
thing.
exactly.
But yeah, nowadays there are more alternatives than ever.
Mm-hmm.
And we're not thinking that diet soda is an alternative to soda. That's not a thing either.
Water.
Water. Diet soda actually impairs the liver, which helps create more insulin resistance. So diet soda is
Okay.
not the thing. I mean, if diet soda was going to be effective, then we wouldn't have seen this ever increasing amounts of prediabetes and diabetes, because a lot of people are drinking diet soda now. They've been literally sold that bill of goods by the soft drink industry. Well, oh, don't drink our soda, just drink our diet soda, and then it won't have all those calories and all
Right.
those
Well,
carbs.
I was just going to say, just because something is low or no calorie does not mean it's healthy for you by any stretch of the imagination.
Yep. So
Fun.
seltzer, if you want some carbonation in there, put
Yeah,
have some
exactly.
seltzer.
With some fruit, fresh fruit, in
Oh
there,
yeah,
delicious. Or
absolutely
even some
delicious.
iced tea with lemon. You can go crazy.
Yeah, absolutely.
So yeah, beware of those marketing gimmicks of something that's portrayed to be healthy when it's just not. So anything
Yeah.
else that we should remove, or maybe other things that we can incorporate into our diet, maybe touch upon a little bit.
Yeah, I mean, I think we mentioned most of the things you should remove:
Right.
the carbs, the sugar. Fruit. Fruit has some carbs in it and has some sugar, but that comes with fiber. So it's good to have some fruit. You get a lot of phytonutrients from fruit. The further along you're on the progression, the less fruit you want to eat. But you should, a piece or two a day is probably fine for just about anybody. But yeah, so yeah, incorporating the vegetables, incorporating the fruits, incorporating the healthy fats, the avocados, the nuts, the olive oil, the avocado oil, those kind of things. Dark chocolate is actually a great treat that a lot of people enjoy, and the darker the chocolate usually means that means less sugar. Actually, the more health benefits it has for you, that higher that cacao is
Yeah.
as a percentage. So that's a great one. Yeah, and just finding the endless ways that you can use all these healthy vegetables. Trying to limit. Most grains have carbs, so you're limiting grains naturally when you do that. But things like sweet potatoes are great to have if you want to have something high carb on occasion. Lots of fiber there. So better that kind of carb than a processed carb, even if it says it's whole grain or it's made from chia seeds or whatever. Those are probably should limit those because they are definitely processed foods.
Yeah. And I know you said, those are great alternatives to those high carb, high fat, those types of diets, high sugar, for avoiding diabetes, heart health, things like that. And these foods that you're just mentioning, aren't they also very helpful to keep our brain functioning as high, optimally as possible as well?
Absolutely. There are so many nutrients in there that are good for brain health, good for heart health, um, help prevent dementia.
Mhm.
And the other thing, I mentioned that the diet will tend to be more, tend towards keto,
Right.
especially the farther along you are. Um, the brain, the heart, they actually function better on ketones than they do on glucose,
Okay.
especially if somebody's insulin resistant. What does insulin resistance mean? It means that insulin has a hard time getting the sugar into the cell for fuel because the cell's already full of sugar.
Okay.
And then it actually impairs the functioning of the cell, so that cell does not burn stops burning the sugar all that well.
Right.
And so it cannot be used as fuel properly. But ketones, they don't need insulin, and they can be burned very efficiently by the cell as fuel. And so when somebody has unfortunately gotten dementia or has an uncontrolled seizure disorder, there's a lot of research out there that their brains work better on ketones than they do on sugar. So the more you need, the more you are, need health benefits from food, probably the more towards keto you need to go. If it's, any type of metabolic process, like even cancer, um,
Mm.
and, obviously diabetes, but again, dementia and controlled seizures, those things respond a lot better to ketones than they do to sugar.
Such good information to have. Yeah, and I wanted to make sure we touched upon the brain health just because we do cover the topic a lot, but it's something that we need to think about as we age too. It's such a, it's such an issue in this country, of course, but we want to make sure we know that nutrition has a lot to do with our brain health as well.
Yep. Yep. The brain needs to think about nutrition. Absolutely.
Absolutely. We do have one viewer right now on Facebook. If you have any questions, please feel free to write them in the chat, or you can, of course, email us or call us if you'd like to have a private conversation and get your answers, your questions answered or concerns addressed. But I did want to just also mention that this again is the Healthy Aging Month series. So we'll be back next week at the same time to discuss some other things related to aging healthy. And again, the following week, just at 1 p.m. So again, if you have any questions related to aging, how to protect your health as you age, come to our live events or watch them on Facebook or YouTube at a later date. They'll all be posted there. And feel free again to either email us at info@princetonih.com or call us at 609-412-1568. Did I have it reversed? 609-512-1468. Yes. I think I need to start thinking about my brain health a little bit. But it is the first week of school and it's been a little crazy in the house with 3 kids. So remembering all new schedules and keeping things straight has been a little bit of a challenge for me personally this week. So I thank you for your patience with me.
All right.
Anything else you'd like to mention before we sign off for today?
No, I think that's it. Yeah, hopefully people will get the message and get on their whole food diets.
Absolutely. And keep your health as you age. It doesn't have to be just chalked up to, oh, this is just what happens when you get old. There are ways to avoid chronic illness and those types of things as we age. So
yeah, I guess I could just mention I was talking to I
yeah.
had somebody come into the office and today and her was telling me her dad, she mentioned her dad, and he's like, unfortunately he's a few years older than I am, but not many, just like 3 years older, and he's had 2 knee replacements, he's diabetic, and just eats the standard American diet. She's really worried about him. But I think if you prioritize, I want to keep people from getting there. I
Right.
want people to be vital and healthy. And I was telling her, what do? I still play soccer with my grandson, practice with him. I'm hurting a little bit the next day. I'll admit that. Joints aren't what they used to be, but it's a good. I earned that hurt, and I was just out sailing. I went to a couple of friends were taking some sailing lessons up in Vermont, and I went up there and was out on a sailboat for like 7 hours a day on the weekend, and came home a little banged up and bruised and sore, but it was great.
Yeah.
And I mean, that's what I want everybody to be able to do, to achieve their full potential, be vital into certainly well into their 60s, 70s, and even 80s. I mean, I know some pretty active and 80 and 90-year-olds. So, that is not out of reach for any of us. Just need to do the right things.
Yeah,
now.
Absolutely. And keep, you want to live, you want to use those years and enjoy the quality of your life. Enjoy your grandchildren, get outside and, just enjoy life and appreciate every day you have.
Absolutely.
All right. Well, thank you so much. This has been so good to hear all the information that you've been giving us. And I look forward to our conversation next week, same time, and look forward to seeing everyone else. Thanks again.
Okay. All right. Take care, Krista. Bye-bye.